I think that CREST-2, whether vascular surgeons kind of want to admit it or not, CREST-2 showed that with better devices, better techniques, better medications, et cetera, that there is a role for transfemoral carotid stenting. Um, that obviously TCAR was not involved in that. I think we all agree that TCAR has had incredible results compared versus standard CEA. So I think between, what we know about TCAR and with CREST-2, there's definitely a role for transfemoral TCAR as well as CEA. We've had changes in our EVAR devices. We've had changes in our CLTI, lower extremity PAD intervention devices. So it's only kind of makes sense that we're going to have changes in our carotid stenting devices as well. And Pat Garrity and I are super lucky to get to lead the CGUARDIANS II and III trials for Inspire MD. I can't really speak about the other carotid stent options that are out there, but I can tell you with Inspire MD, they have the CGuard Prime stent, which is a traditional open cell stent, but also with the micro mesh or the micro net, which is kind of like a polyester type material. It's really an open and closed cell stent all in one. So I think with that technology, we're gonna see safer procedures in the short term and excellent long-term results. We had nothing but zeros. We had no strokes, no stent thrombosis, no TIAs, no deaths. It was incredible results. And last week we got to do the first patient a roll-in for CGuardians 3 with their new neuroprotection system. And I'd tell you that it was pretty seamless. So I think the future is bright. We're going to have new flow reversal options, and we're going to have newer state-of-the-art stents. So the CGuard Prime is new technology to us here in the States, but outside the US, there's already been almost now 80,000 implants. So it's not a new device that we're, enrolling patients and treating them like guinea pigs at all. This is a proven device. We just have to go through the appropriate steps here in the States with the FDA to get this approved. And we've already submitted the CGuardians 2 trial, which was 50 patients. And again, nothing but zeros, no stent thromboses, no TIAs, no strokes, no complications. It was incredible. So, but that's, it's already proven and it's known throughout the world. It's just not known here in the States. And pretty soon folks are going to hear about it.